today. I am joining from the support office of Beyond Essential Systems based here in Suva, Fiji. We have all joined this session to talk about SENAITE, the Lab Information Management System, for the second webinar we have today. Thank you very much for those that have already joined. And while we wait for others, I will take you through the upcoming webinars we have. The next one is on 12th of September 2024 at the same time. The webinar will be about the mSupply Health Supply Hub, engaging digital procurement of medicines across the region. Now, as you can see, the different time zones are already detailed on the slide. Apart from that, we have 3 more future webinars happening this year, and these are the Pacific Health Information Support Hub information session. We have from EMRs to data warehouses, a deep dive into health data, and lastly, the transition to open mSupply. Apart from 3 webinars and all this session, I hope you enjoy whatever YouTube videos we will be loading of this recording. So please go to Beyond Essentials YouTube page to see the recordings. Thank you. And I would also like to take this time to thank DFAT for supporting this, and a huge welcome to all the DFAT staff that have joined us. Now, this session is about SENAITE, like I have mentioned, the Laboratory Information Management System. The heroes of this project here at Beyond Essential Systems, of the product more like at Beyond Essential Systems, are Saha, Mark, and Monica. Any questions you have, they are the 3 main people to go to. They will be talking about 4 different topics in context of 2 different Pacific Island nations. These are Palau and PNG. The topics that they would be looking into are Introduction to SENAITE by Saha. Then we have Tamanu and SENAITE integration in Palau by Mark. Also, Mark will be taking us through PNG context, which is for animal health PCR module. And lastly, we will have Monica join us about microbiology module and referral control panel for PNG. Apart from all this, if you have any questions or any question in relation to the webinar as well, please feel free to post it in the chat and we will get back to you. Let's welcome Saha Athasan. She will be doing the introduction for SENAITE LMIS. She is joining us from all the way in Brisbane, the program manager of the product, who has 14 years experience in different departments as a medical scientist. Wow, medical scientist. Cool, right? She will be taking us over the introduction, as I have said, and it has been a great pleasure to introduce you, Saha.
Good morning, everyone. Thank you for joining us today. I'm really excited to talking about the clinical laboratory management system we have, SENAITE. Okay, a system is built to support our clinical laboratory departments, including biochemistry, hematology, microbiology, and also blood banking, and more. This eliminates the needs for the different system in each department. One of the key features of the system is that it can connect with external services through the public API and ensuring data exchange and integration with other systems. SENAITE is user-friendly, is easy for the lab scientists and the personnel to navigate and use it effectively. We offer customization for each lab and also training for all of the staffs that they're actually using SENAITE in each laboratories. SENAITE provides statistical data. It can generate monthly and yearly reports, and also it generates CSV file for the Burnet report as well. In this slide, I would like to talk about the main challenges the lab faces when they don't have the LIMS system. One of the significant challenge labs face is relying on the manual data entry and tracking system. This process is not only time-consuming, but also highly prone to errors, which can lead to inaccuracies in test result and also delays in reporting. Without a dedicated system, managing the workflow of the samples and the test and also the task can be very quite challenging. Labs may struggle with the holdups and delays and make it very difficult to prioritize urgent tests. This inefficiency can significantly impact the overall productivity and turnaround time in the lab. Obviously, security and data privacy are very crucial and a critical concern in any clinical setting. Manual system and the physical records often lack of the suitable security measures and increasing the risk of the breaches and the privacy issue. Generating reports and analyzing data manually is another major pain point. This process is time-consuming and can also significant delay in providing crucial information to the clients and also the stakeholders. What can SENAITE do to solve this problem? So the first problem was the manual data entry. So SENAITE addresses this issue by providing an automated system for capturing and recording the data from the laboratory instruments, processes, and the experiments that they do. This eliminates the needs for the manual data entry, significantly reducing error and saving valuable time for all of the scientists. SENAITE improved laboratory workflow by providing a centralized platform to manage and track samples and also the tests. This ensures smooth and efficient operation, reducing delays and also improving overall productivity. For the security part, SENAITE include features for the data security and privacy, such as the user authentication, access control, and audit tracks. This feature ensures that only authorized personnel and scientists can access sensitive data and they can perform specific actions. SENAITE provides the real-time data and easy reporting. It allows users to generate customizable reports and perform analysis on the collected data efficiently. This is the list of the different places, include the one that are currently using SENAITE and also the future projects that we have. Port Moresby General Hospital and Goroka Hospital, they are both in the PNG using SENAITE at the moment for the microbiology department. Palau is using SENAITE for all of the departments. Mount Hagen and Ley, they are using SENAITE for the microbiology department. And Animal Health in PNG, they're actually using the specific and customized SENAITE system for the animal sample. Kiribati, Samoa, Nauru, and Tonga, they are all future projects that they're going to have the SENAITE very soon. I'm going to talk about the sample registration page very briefly. SENAITE sample entry features offers extensive customization options, so it's allowing you and all of the scientists to modify it based on your laboratory's specific requirements. It means that you can actually set up the system to match your unique requirements and the workflow. User can easily enter a wide range of fields to capture information, which is including the hospital details, doctor details, and patient information and sample is specific for each test. And also the test can be actually recorded as an individual test and a panel test as well. The flexibility ensures that you can actually accurately record all of the necessary data related to each sample. Thank you so much. I'll pass it on to you, Safia.
Thank you so much, Saha, for the great introduction of SENAITE, the Lab Information Management System. Now it's time to welcome the project manager who has 12 years experience in clinical laboratories as a medical scientist. Again, wow, BS has another medical scientist. And his name is Mark Hunt, also joining us all the way from Brisbane, who will share in regards to Tamanu and SENAITE integration. Over to you, Mark. It's been a great pleasure introducing you.
Thank you, Safia, and it's been great to be here today, and welcome everyone else. So today I'm going to talk about the Tamanu and SENAITE integration, which we went live with in the Palau National Hospital laboratory about 2 months ago, and it's been a great success. Just a second. Next slide, thanks, Safia. So first up, I'd like to talk about the integration workflow. So we start off with the workflow with the clinician that creates the lab request in Tamanu. And then the laboratory will then use the active lab request function in Tamanu to go out and collect the samples based on which ones haven't been collected yet. Once they've collected it, they can then enter the collection details into Tamanu, and then they can transition the request into results pending. And then at this point, this is when the request will become available to SENAITE. So SENAITE will then fetch all the available requests, and then it will register them into SENAITE. So this eliminates the need for the lab assistants to do this. And then the laboratory will go ahead and do their normal testing, enter and verify the results. And then finally, they will end up publishing the report. And then the PDF report will then get sent directly to Tamanu. And then here, the clinician can look at the report within the lab request. So with the integration, we have a number of workflow improvements, which help the lab in particular to go about getting their results out a lot faster than they used to. So the first improvement is there's no need for the lab to print the lab request from Tamanu. They can just use either Tamanu or SENAITE to know exactly what the request has on it. And then throughout, there's also the PMI gets updated, or the patient master index. So this gets updated automatically now whenever a new patient is entered into Tamanu. This is even if they haven't had a lab request created. And there's no need to register the samples, as I mentioned. So over here on the right, we'll have the registration page, which Sahar mentioned, and this will be eliminated completely with the integration. Also, the lab request statuses. So these are when the lab transitions the request from results pending to be verified or verified. This can be updated automatically in real time, and this allows the doctor to track the sample so they know exactly where the sample is and how long it may be for their results to be available. And then, as I mentioned earlier, the published PDF will be available automatically into Tamanu. Before, the lab used to download it from SENAITE and then upload into Tamanu manually. So that's a big improvement as well. So briefly, I'm going to talk about the lab request statuses. So these are the request status either in the lab request or within SENAITE, and this allows the clinicians and doctors to know where the sample is up to. So we'll have Tamanu-specific statuses. These are to be collected and reception pending. So these are statuses that mean the sample has been requested or it has been collected, but it doesn't necessarily mean it's received into the lab yet. So the Tamanu and SENAITE status transitions include results pending. This is where the lab transitions it into be available for SENAITE to pick up the request. And this means that the actual physical sample has arrived at the lab. And then we have to be verified, verified, and published. And so these are all obviously just transitions within the testing. And then we have rejected and invalidated workflows. So the rejection sample, you can see at the bottom screen here, this will actually automatically update into Tamanu when it's rejected in SENAITE, and we will also get a PDF notification sent over. So this allows the lab to select why the sample was rejected, and then it also informs the doctor about why it was rejected, and if they need to go ahead and maybe order a recollect or create a new lab request. And then our invalidated sample workflow. So this is on the right of the screen here. This shows the report that has the invalidated sample at the top, and then it has the amended results. So this workflow is when the lab has published a report, but for some reason they need to invalidate the results and then republish them. And so this is a great workflow where the doctor will receive this report and it'll know that to ignore the top results because they have been invalidated, and then to make any future clinical decisions on the amended results at the bottom. Next slide, thanks. And then finally, for integration, I'd like to talk about the interoperability. So this is the resources that we used to create a standard for when we were to transfer data between both platforms. So HLF7 FHIR, or the Fast Healthcare Interoperability Resources. This was used to create a standardized exchange of information between both Tamanu and SENAITE. And we used the FHIR service requests and sample priorities. So this was to ensure that the correct details that were entered into Tamanu were also the same details entered into SENAITE. And then finally, we used FHIR diagnostic report statuses. So this is, again, for the transitions between each request and sample status. So this is, again, to make sure that Tamanu is reflecting the same status that SENAITE is showing. And along with FHIR, we used LOINC, which is the Logical Observation Identified Names and Codes. And this is an international standard for identifying health measurements, observations, and documents. So within SENAITE, we have the LOINC codes used for all lab tests and panels. And this is to ensure that the correct observation, in this case, the test, is matched with the correct answer, being the result value that was actually obtained by the laboratory. And again, the reason for this sort of work is to make sure that the result that we have in SENAITE will again end up being the correct result transitioned into Tamanu, and it will show in the correct test as well. So by creating these interoperability resources, it means going down the line, if we have ever need to integrate with other platforms, we can hopefully have a much better framework and an easier way to streamline those integrations. Okay, so now we're going to move on to an integration demo, which I'll show you how the integration works in real time. And then we'll finish that off with a testimony from one of the laboratory scientists in Palau, which is Glover Bintoro. All right, so we'll just wait for the presentation to begin. All right, so here we see Tamanu, and so this is from a lab perspective. So we go to the active requests, and down the right-hand side there, you can see all the samples that need to be collected. So we'll go down to our test patient, which is William Hiroto, who unfortunately is back in hospital again. And then we'll go into his lab request, and we'll go in and record the sample. So here we can enter the time and date the sample was collected. We can put collected by if we want to. We won't do that at this point. And then we'll put the sample type or specimen type, which is serum. And we can also put the site. So this is where the physical location of the body that the sample was collected. In this case, was probably drawn from the arm. Now you'll see it's transitioned to reception pending. So remember, this doesn't mean that the sample is ready for SENAITE yet. So we need to transition manually there to results pending. So this allows the lab to take control of which samples have arrived in the lab already and which ones haven't. And then, so automatically this request will get sent over to SENAITE, and we'll go down from the sample dashboard and we'll click on our request. And if you can see up here, we've got all the details from Tamanu. So we got the hospital and clinic, the sample type, the analysis profile that was selected by the doctor in question, and we've also got the site. Date of birth will be there, the sex of the patient, and also the Tamanu ID. So now we'll go through and enter our results for the thyroid function. So we've got T3, T4, and TSH results being entered here. And we'll just save and submit those. And then this will transition the sample to be verified. So you can see at the top there, it's to be verified now. And then you can also see here, we've got result out of range. So we've got the T4 that is low, and then the TSH that is high. So we've got a automatic reference range, out of range result flag there for that. So now we'll verify the results, and then the sample automatically verifies as well. And then we'll go ahead and publish. So at this point, SENAITE is generating the PDF report, and this will be the report that will get sent out to the requesting clinician. And so we've got the logo of the hospital or lab, we've got the results, who entered the test, who verified it. And then right now we'll save it. So at this point, this is when we'll get the status of the sample will transition to published. and the generated PDF report will get sent over to Tamanu. So we can now see in SENAITE, the sample is published. And if we go back over into the patient file in Tamanu, so we'll go back and find William. And then we'll go into their existing encounter and active lab requests, and you can see the status has transitioned to published. And if we go into the request, we'll be able to go view report. And the report from SENAITE will be there available for the doctor. And they have the option to download or print the report, whichever they want to do. And that is the integration. Thank you.
We will soon have the next video coming up. Thank you.
LIMS Tamanu and SENAITE system have greatly benefited Palau National Hospital by helping us quicken the pace of lab result delivery to doctors and other clinicians that need the results. And because of this benefit, us people in the lab have much more quicker turnaround time, and everything else is being processed much more efficiently, giving us chances to also do more the various types of analysis for other patients as well. So we can, as a lab team, we can multitask because of this one system. Lastly, personally, I really like this system because we don't have to write anymore. The writing was very tiring, but now we only have to, just by a click of a button, and then because of the integration, all of our samples and results are now sent to the doctors.
So much. I'll just share my screen again. Thank you so much, Mark. Now we'll have human and animal health LMIS in Papua New Guinea. This would be about delivering One Health capabilities by connecting clinical, referral, and national laboratories. Wow, connecting three different, amazing. Three aspects we would be talking about: animal health PCR module, microbiology module, and referral control panel. We'll again have Mark Hurd take us through this. So welcoming you again, Mark, for animal health PCR module. Over to you.
All right, thank you again, Safia. Yes, so the animal health PCR module, we've developed this in partnership with the National Animal Health and Food Testing Laboratory, or NAFTL, in Port Moresby in PNG. And yeah, it's been very great working with them, and it's been a very eye-opening experience learning how to work with the animal health laboratory. So it's been very good. Next slide, thanks. So the animal health PCR module, before I move on to the analysis, I just quickly like to talk about the registration of the consignments, because obviously the way samples are received for animal health and human health is quite different. So we can get up to 100 samples at once for the animal health consignments. So within SENAITE, we've created a consignment-specific registration page, and this is where you can enter details for all samples that are related to the consignment. This includes the date that this consignment was sent, that it was received or collected, and you can also put field ID numbers and also the consignor who was in charge of it. Also, we have a sample point which can be added at this point, and this is used to indicate physically where the samples were collected. And within the sample point, we have GPS coordinates, FAO sector, and physical address. And so most likely, a lot of times, the sample point will be a farm or maybe a processing facility, and then we'll use those sample points each time we create a consignment for that client. And as I mentioned earlier, up to 100 samples can come in. So we've created the registration where you can actually create 100 samples at once. And this can also include within the same consignment different sample types, animal species, age, or sex. So you can get a variety of samples in one consignment, and you can use SENAITE to log them at the same time. We've also used the SENAITE clients function to track the consignments that have been submitted from one client owner organization. And then these can then be stored under that same client, which allows the lab to go back and find these consignments quite easily when just going into one client or owner or organization. And then finally, we have the transport and inspection assessment form. So this can be used to log details relating to the samples and how they arrived in the lab. And then this, again, is a procedure that the lab will do to make sure that they know the samples are fit for purpose and they can be tested. And this form will then be saved into SENAITE for future reference. So I'll now move on to the PCR module and the actual analysis. So we have set up a PCR analysis that captures the CT values, result observation, that's the positive, negative, indeterminate. And within the analysis, we have up to 3 CT values that can be entered. And then the mean will be calculated automatically from these 3 CT values. And there is scope within the system to create an unlimited amount of PCR assays. It truly depends on the lab and what their needs are. At the moment, we have about 12 set up, and that includes African swine fever, influenza, and a variety of other PCR assays. And again, because of the nature of how the samples arrive, we have the option to enter multiple results at once. So here we can see you can have the CT values for up to 3 values, the mean, and then you can choose the positive value. And we've got 5 samples here that can be entered at once, and they can all be saved, submitted, and verified. And then also we can then show these same 5 specimens all on one report here. So you don't have to have an individual report for each sample. And it means you can, again, you don't have to report all the results, but you can choose whichever ones you want. There may be the positive or the clinically significant results, and then have that on the final report for the consigner to look at. And then finally, with the PCR module, we have created a DNA and RNA extraction sample workflow. So the DNA and RNA extraction sample, these are created from the laboratory, from the primary samples. And this may be every sample they get in for PCR testing, or it might be just the positive ones that they find. And within the system, we have the ability to create subsamples. So these are samples that are created, connected and linked to the primary sample, but they're in reality, they are their own unique sample as well. Once again, we have the option to create multiple subsamples at once. So this will save time for the lab. And then you can also add extraction date, time, kit name, kit batch number, or any other sort of details you want based on the extraction details for the samples that were collected. And then we can use the SENAITE worksheet function. So this will allow you to add those details all at once, again, saving time for the lab. And then finally, once you've created the samples, you've aliquoted them off and you've got them ready, you can then use the inbuilt SENAITE module, and this can be used to store the samples within SENAITE. And this means the lab will be able to track physically in the lab where the samples have been stored. And then they can go on to use these samples for future testing or follow-ups. So that's it for the PCR module, but I just want to mention as well, Monica will be moving on to the microbiology module, but we also have the microbiology module available for animal health. It's not just for the human health testing. So thank you.
Thank you so much, Mark. Vinakavakalevu for the country-based details. Now, we have our 3rd scientist coming to present to us. Who do you think she is? She is Monica Lal. From the beautiful silver office of Beyond Essential Systems, we have Monica Lal, the project manager who has 15 years of experience as a laboratory scientist, joining us to shine light on the microbiology module and the referral control panel. It was a pleasure introducing you, Monica.
Thank you, Safia. And hello, everyone. Having an automated system saves time and reduces the risk of errors. And with SENAITE LIMS, labs can achieve this. SENAITE LIMS can efficiently monitor various aspects of laboratory operations, such as sample monitoring, sample workflow, managing analysis, and more. In today's session, I will give an overview of the microbiology module used in clinical, reference, and research laboratory, as well as the referral control panel feature that can be used for public health and reference laboratory. And under these 2 topics, I'll be focusing on 3 aspects each. Let's now look at the microbiology module features. The sample dashboard on SENAITE includes a range of features to allow easy access to relevant information for sample request. It can generate unique patient and sample ID for the samples that have been registered. The sample filter function allows the user to filter samples as per sample status. The sample search function allows the user to search a sample using different variables such as patient name, hospital number, etc. It also has the ability to configure the table columns. That means the columns can appear as you wish on your sample page. SENAITE also displays different sample icons for alerts. For example, we can have icon for insufficient sample and for extended turnaround times. If you see the picture on the left-hand side, you may be able to see the different tabs used for sample filtration and a search box there. And down below, there are more search functions. As for the sample workflow, all samples registered in SENAITE are allocated a unique ID and status. The sample status will automatically be updated based on the actions performed against this sample, as shown in the diagram below. Moving on. So microbiology module, the analysis, sample analysis page. Here, the SENAITE, on SENAITE, we have the antimicrobial sensitivity testing, in short AST, breakpoint tables, which can be pre-configured for either UCAST or CLSI guidelines and can be easily edited when required. The AST panels are predefined to meet guidelines and are aligned with the lab SOPs. SENAITE has the capability to use both disk diffusion and the MIC method for AST testing. The users can record multiple positive cultures at once, making a result recording faster and convenient for the lab. This can be seen in the pictures on the left. The manage analysis function can be used after the sample is created, allowing users to change, add, or remove tests. The sample partitions can be created from the primary sample in cases of additional test requests or for referrals as well. The SENAITE can reject, retract, cancel, or invalidate tests within the system. For example, if a scientist receives a sample that is unsuitable for testing, this can be rejected within the system and a PDF form report is generated with the rejection reason. The role-based permissions on SENAITE controls the action lab staffs can perform on a particular sample. It also offers real-time data visibility and reporting. The pre-configured result interpretation templates prevents users from writing long and lengthy descriptions for a particular result. SENAITE generates customizable reports in PDF form, and these reports can also be emailed to the clinicians via the SENAITE system. It also has an audit log to track samples, where you can see what happened to the samples after it was logged in. Moving on. The microbiology module here on SENAITE, we have the capability to export the microbiology results to HUNET. A CSV file is generated by simply selecting the dates and with a click of a button, which can be then easily downloaded and data saved in form of Excel sheet. And let's now look at the referral control panel features on SENAITE. The referral feature on SENAITE allows the users to refer or send away samples from one laboratory to another, that is from one SENAITE LIMS instance to the other. If you refer to the picture, the first picture on the right, you can see the referral control panel could be accessed through the sidebar menu, and the two listings used there are external laboratories and shipment. Unique shipment ID and sample ID is generated here. It uses standardized test request. This feature ensures effective and timely communication between laboratories. There's protection of patient confidentiality and privacy as the samples go de-identified from one instance to the other. It has an effective reporting system. There's better sample traceability with this feature, and of course, it saves cost and time. Moving on. sorry, if you can go back a slide, Safia. Thank you. Sample referral from our referring laboratory to our reference laboratory. Here, a unique shipment ID is created, and all the samples that are supposed to be sent away from the lab is listed under this shipment. The shipment manifest is generated once the shipment is ready for delivery. This shipment manifest will contain all the necessary information related to the shipment and the sample, as shown in the picture on the right. It also instantly notifies the when the samples are received on the other side to the reference laboratory, and it also captures date, time, shipper details, etc. On the SENAITE system and also on the shipment manifest. Moving on. Receiving shipment by referring laboratory. The referring laboratory is notified instantly when a sample is received or rejected at the reference lab. Here, what happens, a pop-up message will come that the remote laboratory has been notified successfully. A new local sample ID is generated at the reference laboratory when the sample is received. The referring laboratory is notified instantly once test is complete and the results are published. The referring lab receives results via the SENAITE system. So you don't have to send it via mail or other modes of sending. And lastly, it can easily track samples which have been referred to the reference lab, which you can see in the picture down below. There are different tabs to filter these samples. And that is all from me today. Thank you all for listening, and over to you, Safia. Thank you.
Thank you so much, Monica. That was great. Again, just reiterating, thank you so much, team, for that amazing information that you have shared. Also in regards to the context of Palau and PNG. Now, we have seen that the chat question have almost been answered, but I will just open the floor as we do have time. If people want to unmute themselves and have a conversation with the amazing super team we have of the 3 scientists who are available for you here in this chat today. Over to the team.
I'm going to go to the first question that Tessa asked. I think Mark nicely answered that question in the chat. And yes, SENAITE can actually connect it to any analyzers. For your second question for the epicenter, interfacing with the epicenter, we're actually going to do that in Goroka for the first time. And we believe that is actually possible to do that connectivity as well for the MIC values from the Phoenix. And also for the last question, how do clinicians get notified out of SENAITE? So if Tamanu is not used, you can actually get the report through the email by SENAITE, or you can actually get it like as a PDF report by email if we can actually add the emails of the doctors into the system so they can receive the result through that as well.
Thank you, Saha. Any other questions? Okay, I believe everyone who has joined has their questions answered. But if you do come up with other questions later, please feel free to contact our SENAITE program manager, Saha. Our email is on the screen, saha@bes.au. And someone just raised their hand.
Hi, Safia. Hi, sorry, it's Navin here. Thank you for the fantastic presentation. It's great to see many of our laboratory professionals working on SENAITE and Tamanu. Just wanted to ask, like, whether you had a set list or template of data extraction from SENAITE. This is like monitoring turnaround times, managing workload and workload statistics, and other quality indicators like error rates, sample rejection, etc. If you could please elaborate on that, or if there's something that has to be built based on the request of the country and what quality indicators and data extraction they need out of SENAITE would be helpful. Thank you.
So in terms of the statistic reports that you mentioned, we can actually have set up the different statistic reports for the for each laboratories, and we can actually add the rejected. You mentioned about the rejected sample, so we can actually have a specific a statistical report for each lab based on the requirements. At the moment, for the PNG microbiology department, we have 21 reports, and we actually added another 6 to it based on the requests. So it's all of the feature, all of those specific requirements that they have for the final, like a statistical reports, is all actually coming from the labs, and we can actually customize it for them and they can actually use it.
Thank you, Saha. Naveen, do you have any other questions or need further clarification? I can see your thank you in the chat. Anyone else? Remember, we have our 3 scientists right here for you if you have any questions. Okay, no problem. Thank you so much. And Alexandra, thank you so much. And yes, we do appreciate the support that you all are giving us. There's a lot of fantastic work going behind the doors, and there's a lot of potential, as you have seen the 2 country examples that we have already shared, like we have for Palau and PNG. And like Saha has mentioned, there are 3 upcoming countries in regards to SENAITE that we would be able to share probably in the next year or as soon as we have more updates for you. So thank you so much. Again, any other questions, Saha? And this particular recording would be available on our YouTube page at Beyond Essential Systems 7459. See you all in our next webinar on 12th of September 2024, same time, and hopefully with the same host. For M Supply Health Supply Hub, Vinaka. See you all.